my name's Katie. I'm going to be your nurse today. Today we're going to be doing a health assessment. So I'm going to provide privacy and perform hand hygiene. Can you state, or I'm going to state general appearances. So she's a 20-year-old female. She looks well nourished. She's dressed appropriately for the weather. There's no signs of distress. Can I have you state your name and date of birth?
Brianna Moody, July 24th, 2000.
And then can you tell me where you are right now?
In my apartment.
Who's the president?
Donald Trump.
And what's the year?
2020.
So she's awake, alert, and oriented ×4, and her speech was clear. There's no hoarseness. She articulated well. I'm going to test for her muscle strength and have her resist my hand. And then resist my hands with her shoulders. So that was intact bilaterally and symmetrical. And then I'm going to have her squeeze my fingers. So strong grip bilaterally. And then push up on my hands with her feet. And then down. And then same thing with her arms. Push up and then down. Muscle strength was intact in the upper and lower extremities. And I'd rate that a 4 out of 5 on the muscle strength scale. And now I'm going to test for dermatome, for dermatomes. So I have a sharp and soft object. So I'm going to let you feel what those feel like. So you're going to close your eyes and then tell me where I'm poking you on your either of your arms or legs.
Upper right arm sharp. Lower left arm soft. Lower right arm sharp. Upper left arm soft. Upper right leg sharp. Upper left leg soft. Lower left leg soft. Lower right leg sharp.
Okay, so her dermatome sensation is intact. And now I'm going to do deep tendon reflexes. So I'm going to do the triceps right behind the elbow. I'm going to have her relax. And I would hit that. And her arm would come out if I had an actual reflex hammer. And then I'll do the same thing bilaterally to compare the two. And that's testing C7. And then the biceps tendon. Do that bilaterally, and that's testing C5 and C6. And then the brachial radialis. And then moving on to do her knee jerk right below the patella. And that is testing L4. And then the ankle reflex, I'll support her leg and hit where the top of her shoe would be. Do that bilaterally to compare the reflexes, and that tests S1. And then the Babinski reflex. I would draw like this, and she's ticklish, and test the other one going in that formation. So her deep tendon reflexes are intact. And And then to test her gait, I'll have her stand up and walk across the room flat-footed, and then come back, and then walk on the heels of your feet.
Like this?
On your heels.
Oh,
yeah.
only my heels?
And then come back, and then walk on your toes, and come back, and then walk heel to toe, like touch your heel to your toe, like,
Oh, okay.
okay, good, you can have a seat. Okay, and then her gait was good, so I'm gonna check her head now, and I'm just gonna feel for the shape and contour, make sure there's no lesions or trauma, no abnormalities were felt, and then I'm gonna look at her eyes, and I'm gonna test for perla. So her pupils were equal, round, reactive to light, and had accommodation. And then I'm going to look in her nose, tilt your head back. Okay, her nose is pink and moist, and then I'm going to look at her mouth, and there's no signs of cyanosis. Open up, look at her lips, and so there's her oral mucosa was pink and intact. And then I'm gonna look at her neck for jugular distension, and her trachea is midline. And I'll look at her breathing. She's not using any accessory muscles. And I'm gonna palpate her carotids one at a time. I don't feel any thrills. And now I'm gonna auscultate them. That was normal. I didn't hear any bruits. And now I'm gonna move on and look at her chest contour and just look for any lesions or scars. I don't see anything. Everything appears to be normal. Her effort of breathing, there's no intercostal or substernal retraction, and it's normal and effortless. And she doesn't show any signs of tripoding. And now I'm going to palpate 6 positions on her front chest and on her back. So there's no abnormal lung vibrations on her front. Lean forward. And no abnormal vibrations on her back. And now I'm going to auscultate 6 positions on the front and 8 on the back. There's no crackles or wheezes bilaterally, and I didn't hear any bruits. I'm gonna have her lean forward. And when I move it, just take a deep breath. And again, there were no abnormal sounds, no wheezing or crackles, no bruits bilaterally. And now I'm going to have her lift up her arm, and I'm going to listen to 3 spots underneath her axilla. Okay, no crackles or wheezes bilaterally. And now I'm going to do the cardiovascular part of the assessment. And I'm just going to start by inspecting the cardiovascular region. Make sure there's no abnormal movements. And then I'll palpate the right midclavicular line, about 2 intercostal spaces down, and then the left midclavicular line, 2 intercostal spaces down, and then I'm going to palpate over her major valves to make sure that there's no abnormal vibrations. So the aortic, and then the pulmonic valve, and the mitral or the Erb's point, tricuspid, and then the mitral valve. And there were no abnormal vibrations. And then I'm going to assess the apical pulse. And it's strong and regular. And now I'm going to auscultate those over where those valves are. So starting at the right midclavicular line, the aortic valve, and then the left midclavicular line, down 2 intercostal spaces, the pulmonic valve, and then move down 2 intercostal spaces to Erb's point, down 2 more intercostal spaces to the tricuspid valve, and then to the apex of the heart for the mitral valve. And I was listening for S1 and S2 in all of those, and making sure there's no murmurs, no S3 or S4 sounds, no rubs. And then I'm going to do capillary refill by pressing on her fingertips. And they're brisk and normal, less than 2 seconds for capillary refill. And now I'm just going to check for peripheral edema by pushing in. There's no signs of edema in her arms. Check her legs. And those, no signs of edema. And now I'm going to check the rest of her pulses. I already did her carotid and apical, So I'm gonna do her bicep, just strong and equal on both sides. I'm gonna do her radial pulses, which are strong and equal on both sides. The popliteal pulse behind her knees are strong and equal on both sides. And then the dorsalis pedis and the pedis tibialis on her ankles and feet. And those are both strong and equal bilaterally. And then I'm just going to check for warmth using the back of my hands. So her skin is warm and intact, no coolness, no cyanosis. And then at this point in the exam, I'm going to have her lay down.
On my back?
Yeah. And I would inspect her abdomen for contour and color. Make sure that there's no lesions, that her umbilicus is midline, and then just look at like the shape of her abdomen, and then I'm going to auscultate before I palpate. That way there's no interfering noises. So I'm going to auscultate each quadrant and listen for bowel sounds. So usually you listen for 3 to 5 minutes, but she had active bowel sounds in all 4 quadrants. And then I'm going to listen over her arteries, her renal and iliac, and the aortic right above her umbilicus. So I'd find her belly button and go about 3 centimeters up and listen to the aortic artery. And then find her kidneys and listen to the renal artery. And then move down 2 centimeters to the iliac artery. So there's no prominent venous abnormalities or bruits, and you can test for the femoral during a patient exam, the femoral arteries. And now I'm going to palpate her stomach lightly in gentle circular motions. Make sure there's no atelectasis. So everything seems to be normal. And then lastly, I'm going to do percussion by tapping on my fingers and listening. And there's normal noises, and that concludes the health assessment.